Fluorotech Biosystems Kapillary Malaria Test is a fluorescent microscopic test based on the principles of concentration and fluorescence. The technology intends to address the limitations of the conventional microscopy and rapid diagnostic test format by being far more sensitive, specific, quantitative, while still being extremely convenient and fast to perform. For performing this test, you need the following setup: a fluorescent microscope, a hematocrit centrifuge which operates at 12,000 RPM, a capillary malaria test kit. Let's understand the contents and installation procedures. Fluoron contents: a 5-watt powerful blue LED light source with collimating lens. Fluorescent lens adapter having 60x oil immersion objective lens. AC/DC adapter. Capillary holder 2 units. Let's understand how to install the Fluoron AP fluorescent microscope module. Fit the fluorescent lens adapter to microscope nose piece. Screw in the illuminator to fluorescent lens adapter. Connect the adapter to power supply. Connect the adapter pin to illuminator. Turn on the power supply. Please note the blue light coming out of the lens. Illumination intensity can be controlled by adjusting the knob function. Fluoron is now installed and ready to use. Let's understand the contents of capillary malaria test kit. A capillary malaria test kit consisting of glass capillary tubes pre-coated internally with the fluorescent stain acridine orange. A packet of tube plugs to seal the capillary. A packet of plastic needles called suspender. A plastic forceps to insert the suspender. An immersion oil bottle suitable for the test. And an instruction manual. Let's understand how to process capillary tubes. Patient's blood specimen is collected inside of the capillary tube up to second blue calibration mark. Wipe off the tube from outside using tissue paper. Specimen is allowed to get mixed with fluorescent reagent present inside of the tube. Tube is sealed using plastic plug being provided with the kit. Plastic needle called suspender is added from top. Tube is placed inside of the centrifuge machine. Make sure to balance centrifuge rotor by keeping one tube in opposite slot. Place the lid on rotor head and screw the same. Set the centrifuge at 12,000 revolutions per minute for 5 minutes and centrifuge the tubes. The plastic needle inserted earlier separates various cell components as per their specific density to form discrete bands. The discrete bands are as shown. Let's understand how to focus the capillary tubes. Tube is placed in a specially designed capillary holder. A drop of immersion oil is put exactly at the interface at RBC and buffy coat. Allow the blue light to center on top of the tube. Slowly bring down the objective lens to dip the same in the immersion oil while taking care not to crash the lens into capillary tube. Using microscope adjustments, focus the tubes in such a way that blue light goes completely into the capillary tube. Make sure you get the area of observation under complete focus. Now let's understand how to observe the capillary tube. Observing the negative specimen. Once the capillary tube is focused under the fluorescent microscope, centrifuge capillary shows various cell layers settled inside of the tube as per their specific densities. The staining reagent inside of the capillary tube is fluorescent reagent acridine orange. Acridine orange is a nucleic acid stain. Upon excitation with blue light wavelength, it emits very bright fluorescence. Acridine orange stains DNA and RNA intensely. It stains various cells of WBCs and platelets in different colors due to the differing pH of these cells. Due to this, granulocytes appears bright orange, lymphocytes monocytes bright green, and platelets pale yellow. RBCs, however, being non-nucleated, does not take up the stain and appears reddish-brown background. Let's understand how the positive specimen appears under the fluorescent microscope. Malaria-infected RBCs, being lighter in weight than healthier RBCs, tends to float and settles at the top of the RBC column. Naturally, the user having far greater chances of coming across with the parasites at this interface of RBCs and granulocytes. So, for detecting the presence of malaria parasites, one needs to focus and search for few microscopic fields at top of the RBC column and buffy coat. Let's understand the probable locations for searching the malaria parasites. Step 1. Focus the capillary tube exactly at the interface of granulocytes and RBCs as being shown in image. One needs to search for the presence of malarial parasites at the interface. Step 2. Focus the capillary tube into the RBC column and search for the malaria parasites as shown in the image. Step 3. Move inside of the RBCs and search couple of more microscopic fields. Step 4. Focus the capillary tube at the interface of granulocytes and lymphomonocytes to look for the presence of some mature trophozoites of Plasmodium vivax and gametocytes of Plasmodium falciparum. Step 5. Focus the capillary tube at bright green column of lymphomonocytes for searching the presence of vivax schizonts. Let's understand how the malaria parasite looks like and its morphological characteristics. Malaria parasites, if present, absorbs the acridine orange stain and emits bright green fluorescence upon excitation with blue light wavelength. On contrasting brown RBC background, it is very convenient and easy to observe the brightly glowing parasites, just like watching stars in the dark sky. Malaria parasites trophozoite appears small round structures with very specific morphology comprising of nucleus and cytoplasm. Nucleus appears bright green and cytoplasm appears pale greenish or orange in color. For simpler understanding, imagine a cut section of a boiled egg. Yellow yolk is a nucleus and egg white is cytoplasm. Similarly, one get to see nucleus and cytoplasm with malarial parasite as well. In fresh specimen, usually a bright green nucleus is attached to a pale green cytoplasm. A few hours specimen shows bright green to yellow nucleus attached to a bright orange cytoplasm. So as to confirm the positive, one needs to appreciate the presence of nucleus and cytoplasm both. Let's understand how the falciparum trophozoite looks like. Falciparum trophozoites are smooth, round, small pinpoint-like structures. Nucleus appears bright green pinpoint dot or crescent moon shape attached to a pale green cytoplasm. Nucleus to cytoplasm ratio is almost 1:1 with nucleus embedded inside of the cytoplasm. Occasionally, one gets to see coma-shaped falciparum trophozoites as well. Rarely, one also may come across with the diamond ring-like large uniform falciparum trophozoites. Falciparum trophozoites are usually seen in large numbers. Area of observation is top of the RBC column and throughout the RBC column. Falciparum gametocytes are large, banana or slipper-shaped structures. These are pale, yellowish-green in color. One can see the nucleus, distinctive vacuole, and presence of black pigments inside. Area of observation, lymphomonocytes, and RBCs. Vivax trophozoite are similar to falciparum ones, wherein these also shows a bright green nucleus and presence of cytoplasm. However, these are almost 3 times as large as falciparum ones. Nucleus is much more distinctive and it's not embedded into the cytoplasm. One can see a presence of vacuole between nucleus and cytoplasm. With falciparum, nucleus and cytoplasm appears almost of the same size. However, with Vivax nucleus cytoplasm ratio is almost 1:3 or even more. Unlike falciparum, which is smooth and circular in shape, Vivax cytoplasm is irregular, rough and fan-shaped. Vivax schizonts are pale yellow to pale green, round ball-like structures, almost similar in size to RBCs. These having fine black pigments or merozoites. Presence of schizonts almost always confirms the presence of Plasmodium vivax or mixed infection, having Plasmodium vivax and Plasmodium falciparum both. Only falciparum seldom shows the schizonts in peripheral blood. Area of observation, lymphomonocytes. Vivax gametocytes are almost similar in size to schizonts. These appears pale yellowish to pale orange structures, with presence of green nucleus along with black pigments. Area of observation, lymphomonocytes or RBCs. Artifacts are any structures, those fluoresce and appear like parasites, but actually are not parasites and may confuse the observer. For conforming, if it is a malaria parasite, one must be able to appreciate the presence of nucleus and cytoplasm both. Artifacts does not show any such differentiation. Please note, capillary malaria test reporting pattern as shown below. Let's discuss few frequently asked questions. For more information on Floratech Biosystems products, you may get in touch with our nearest authorized distributors or contact us at the following email.